So guys, if you have a patient who uses a wheelchair, and if it is a standard wheelchair, a patient sitting anything more than 2 hours, that is a prolonged seating. And when somebody is sitting upright, all the pressure is down on the bottom, and that can cause stiffness, pain, redness on the bottom. It can also cause a skin breakdown, which is pressure sore. So to avoid such injuries, we must use a tilt in the space wheelchair. So what is tilt in the space wheelchair? As you can see this lever here, if I pull this lever and push this chair gently down, now this reclines the person back, and now the pressure is not actually on the bottom, but pressure is distributed on his lower back to the hips to up to the thighs. So there's no pressure points, the pressure is diffused. So this person must be really much more comfortable, and lesser chances that he will develop any pressure sore at all. Now, let's do it again. So you may have a patient who is maybe a CPA, or just due to muscle imbalance, whether it is due to Parkinson's or a stroke. So if the person is kind of leaning forward, leaning on his side, in a poor posture like that, he could have breathing difficulties, his chest is definitely compromised, eating or feeding is difficult, stiffness, more pain, more problems, risk of fall from the chair. To avoid all these things, To avoid all these things, again, once you have a tilt in the space chair, once you recline the person back, you will come back. Once I recline the person back, now this person can see up and around what's happening. So better socialization, better views for him. You can feed him better. He can sit back and his chest is much more relieved. He can breathe better. To ensure a proper seating, you must make sure the knees are not higher than the hip. Now, because the chair is tilted, you might be feeling the knees are higher than the hip. So let me show you a better picture here. If I sit the person upright, now you can see the knees are almost the same level as a hip. But suppose if these foot plates, these footrests were a bit high, something like that, if the knees are higher than the hip, there is more pressure down onto the hip, and higher chances that he will develop pressure points, pressure sore. So you must have an adjustable footrest where you can increase their length or reduce their length, and make sure that the knees are lower or at the same angle than the hip. If the knees are far too low, so just move that and move the other one. Put your feet down. So if the knees are far too low than the hip, the person will be sliding from the chair. See that? So person will slide down from the chair. So it's important that you have the knees really in the level with the hip. So that's about the tilt in a space wheelchair.